I said.
That's true.
I put it on Facebook.
Sorry. No, I understand. We're going to talk through it too, because like I said, this is a lot. I haven't done this since first block, the whole detailed spiel, but I will do the best I can to teach you guys, okay? And if I'm missing something, please tell me, because there's no way I'm going to remember every single thing on here. Make sense? Remember, I'm still a nursing student. I'm not a pro just yet. But I will still try. Okay. Are you ready? So, what do we do first when we walk into the room?
Eye power.
Tell me what eye power is. You guys are so quiet. My girls are not quiet. I know all of you who are not quiet. Don't even do that right now. Come on. Let's go. So, eye power.
Wash hands.
You're going to explain what you're going to do. Okay. So, I'm going in. This is my room. Wash your hands. I always wash my hands first, and I make sure my patient sees that I'm washing my hands. Because if they don't see you, they think you didn't do it. They're like, that's nasty. You're about to touch me. Gross. So make sure they see it, and then you're going to introduce yourself. You're going to close that curtain because you already know they want to be in privacy because you're about to assess their full body and do things that they don't feel comfortable doing in front of everybody else. So you're going to do that. I'm not going to do it because you guys have to see what I'm doing. Okay, then I would introduce myself. Hi, I'm Jenna. I'm going to be your nursing student today. And what's your name? Jennifer, can I see your name band really quick? Can you tell me your last name? Hotchkiss. Hotchkiss. Whoa, I like that last name. Okay, and your birthday? Good. You have to think about it.
I'm not telling my actual one.
Oh, okay.
1595.
Secretive, I like it. Okay, 95. Holy Oh my gosh, nice. Okay, so you know who your patient is now, right? You know who they are. You double check twice because you looked at the name band and they told you, correct? Okay. So then you're going to tell them, okay, I'm going to go ahead and do a full assessment on you. Now, you're going to say this because they're going to know this is going to take a little bit. This is going to take me a little bit, maybe from 10 to 15 minutes, so just bear with me, okay? So we're going to get through this whole thing. I just want to make sure there's no abnormalities, so pretend this is like an annual exam, okay? So this is just your annual exam. It's good to get this done now, so then we know that everything looks normal for you. And you already seem like you're healthy, but I still have to check to make sure. Okay, cool. And she'll say, okay, sounds good.
Okay, sounds good.
Alrighty, so what I told my girls that I had the past couple of weeks, for those who don't know me, I did this by staircase steps. And what I mean is I start from here and I work my way down in steps. Does that make sense?
Mm-hmm.
So whatever's going on in the head, in the face, and neurologically, I'm doing here. And then going here and going down. With your patient, you do not want to be inconsistent with what you're doing. You don't want to be up and down because they're going to be like, what are you doing? Do you know what you're doing? You want to make sure you're at a smooth, consistent pace, starting here, going down. Now, like I said, for my people who already have a routine, don't follow me. It's not going to make you do what I'm doing, but I will do what I did, and you can either follow that or do your own thing. Sound good? Yeah? Okay. All right, so what I usually do is I start up with my patient sitting up and standing first and getting all the standing up stuff that I can out of the way. So then that's done, and they can continually sit for the rest of the assessment because I don't want them sitting up and standing up and lying down and doing that over and over because, for one, what if my patient is sick? What if they're not feeling well? What if they're having respiratory distress? You wouldn't really do a full assessment if they have respiratory distress, but regardless, you don't want them getting up and sitting down all of the time because, for one, that's inconsistent as a nurse. Two, they're sick. That's a lot of energy for them to expel, correct? Does that make sense? Okay, so I'm going to go ahead and have you stand up for me. Okay, so let me work through this really quick so I make sure I have everything that's standing up. I showed my girls I had a couple weeks ago when I told you guys this about standing them up and doing the neuro stuff or the walking or, even the extremities like range of motion and strength against resistance. I would say just do that too, just because that's what you need to do anyway. And then you can verbalize it at the end, like I already did this, and the teachers will be like, you know what, yeah, you did. Okay, I remember that from the beginning, okay? So, let me look at this really quick before we do it to make sure I get everything for the most part when they're standing up. So you've already looked at your patient. You see that my patient's healthy, right? You see her skin looks pretty good. She's pink, warm. I felt her because I touched her when I got her name band on her wrist. She was warm, dry, and intact so far. So that's good. You can include that in your assessment. She seems neurologically intact because she's talking to me. She's answering, and she's pretty much like, smart, I guess, whatever you want to say. I don't know. There's a bunch of things you can say. So, for my person, what I did is I went to neuro specifically because you have to have them walk, do the barefoot gait thing and all that, and the Rombergs. You guys remember all that? Was it a while ago since you've done that, or did you guys say that?
Caution.
Sorry, I don't know how. I was like, do we gotta go? Okay, that's fine. No, I didn't know. That's fine. Okay, so Jennifer, what I'm going to have you do first, I usually have them do the harder stuff first because, I don't know, it just gets it out of the way. I'm going to have you face me, and then I want you to hold on to me. I'm going to have you kind of bounce on one knee. Don't jump, but just take one leg up like this. Follow what I'm doing and bounce just a little bit, like 3 times. Good. And then I want you to do it on this one. Okay, does anyone know what this is? Yeah, balance, but it's what I told you girls. Remember, it's strength against resistance, right? Okay, so you got that out of the way. Correct. Okay, I know my girls who I taught, this was a few weeks ago. If you don't remember, I'm teaching you now, okay? So that's fine. So you already did strength against resistance. That's the standing up one. Get it out of the way. Now we're going to do actual neuro stuff. So looking into this, we're going to do the barefoot gait, heel to toe walk and standing, correct? She's standing fine. I've seen her stand. Now I'm going to go ahead and have you do a heel to toe walk, and I'll have you follow me in case you don't know how to do it. Sometimes your patients don't know what that is. So you're saying, I'm going to have you just do this, heel to toe, and then I want you to walk back to me, okay? So just do it, and I'll go on this side. Just doing it, good, good. Okay, now can you walk back to me that way? Perfect. So then you would verbalize if that's the normal. I'm not going to go through all the normals. You guys should know this by now. I'm just doing the assessment. You guys know to verbalize everything you're doing and everything they're doing and everything you need to say, correct? And you practice that. So I'm not going to go over that. Okay. So next thing I'm going to have her do is we're going to go ahead and do the Romberg. So what it says here is ask the patient to stand up with feet together, arms at the sides, and ask the patient to close their eyes and hold position for 20 seconds. Now make sure, though, your hands are on both sides. Okay, so if you guys want to do it sideways, do it because it's safer rather than behind. But if it's right, you're going to have a leg consistency. So you do this for 20 seconds. I don't know if you're going to do that in your full assessment, but that's what you're going to do it, okay? So go ahead and 20 seconds, close your eyes. That looks good. Everything looks good. You're going to verbalize that as she's doing it. You nervous? A little bit? No? Okay, good. Okay, we'll stop right there. That's good. Okay, so that was another standing up thing. So if you guys, whoever doesn't have a routine in place, go ahead and start writing notes and just, you guys know what it is, but just write the list so then you know in order so it makes you consistent, okay? Because that's what I had to do when I did this. Okay, so far, we did the strength against resistance with the knees, right? And then you can also do the range of motion where they can hold on to you and you guys can do this. It's up to you because they can sit down and do that too. Whatever you guys want to do. So going from the beginning, because this is a full assessment, so I'm going to be going step by step, but I'm going to repeat because it is a lot, okay? So, once again, I did eye power, I had her get up, I did the standing up stuff first. So, I did the bouncing, right, strength against resistance on both sides. You always have to do both sides, you can't just do one. You can do the range of motion, so they kick their leg in and out to see if there's any limitation, any resistance there. Same thing with this side, okay, good. Then you're going to go ahead and do the gait walk. You already saw her stand. She looks good, okay? So now, once again, I won't have you do it. I'll just show them. But same thing. Look so. And you can have them walk, too. If you want them to walk, it's really up to you guys. You can have them heel to toe walk across, and then just have them walk back regularly. So you get it out of the way. It's done, okay? From there, then we did the Romberg, correct? So did we get most of the stuff standing up out of the way? Mm-hmm. Right? Only show me what's on the benchmark. I'm not going to do your fine. I just want to make sure. If there's anything I'm missing that's standing up, please tell me because I'm not going to remember. Which one? Check the spine. Yeah, absolutely. Thank you for saying that because I almost forgot that too. So then you'll have them bend over, have their shirt down or up. I mean, when you do it, I'm just going to have her bend over and do it. And go ahead and just kind of bring your arms down and then go bend over and then kind of just bring your arms like, yeah, there you go. So you want to see that it's midline, right? You don't want to see any curvatures, okay? And then you look to see if everything's even and equal and all that stuff because you have to do that with everything you're doing. You're going to come back up. Good. Is there anything else I'm missing with the spine? I know there was something I was probably missing, but I can't remember. Tell me if there is because this is a really long packet. No? Everything good so far? Is there anything I'm missing while she's standing up?
Her hips are equal bilaterally. The posture is straight.
Yeah, exactly. And this is what you're all assessing as she's walking, right? As she's standing up. You can do all of that while she's standing. I'm just showing you the technique of all of the different things you have to have her do, okay? So that's what I did. So I'm going to list it out really quick. So I had her stand up. We did the strength against resistance, range of motion. We did the heel to walk. We did the Romberg. We checked the spine, right? Oh, do you have questions?
Do you want to do that?
Thank you.
It might, I think it might be easier for you to follow that and
Yeah,
eliminate things,
because this one's more detailed.
I think it is,
Yeah.
right.
Thank
So
you.
this
Awesome.
will make it maybe a little bit easier to make it more concise.
It does. It looks much
Okay.
more simpler. But what I did is what's over your benchmark, correct, from what I remember? Okay, good. I'm just going to look through this really quick. Okay, Jennifer, go ahead and take a seat for me, please. Okay. Like I said, like I told you guys before, whoever has this is more detailed. So I'm just picking stuff out that I know that's on your benchmark. And then the stuff that's detailed, you don't need to do. But just keep in mind that you still have to look at this.
So what I gave her was a copy of the benchmark.
So I need to look at this to make sure, okay? So like I said, this is going to take a while because I have to look at everything, but so far we're good. So I got all the standing stuff done. Now my patient can sit and relax and do the rest of the assessment. You will probably have to have them sit down, like, and lay back and sit back up, but that's okay compared to having them get up and sit down and lay down. Make sense? Does anyone have any questions? No? Okay. Alrighty, let me look what else. So now I'm just going to kind of go with my staircase as far as here and going down. So now I know, okay, I just have them stand, now let me start my staircase going down. So what I usually do is I do the neurological part of everything and the scalp and the head. You're getting tall, but I'm just going to put my chin down. You're okay. So I start up here where the head is, right? So I look at the scalp. So what you guys are going to do is you're going to see if there's any cuts or lesions or anything going on. And you're going to look through the hair. You can huh? You can oh, okay, you're fine. I'm just going to give a little overview. Okay, so you look at that, right? You started here. Now, I'm already inspecting the face. I see that eyes are equal. Nose is pretty midline there, right? Can you smile for me? Good. Keep down. Close your eyes tight. Can you raise your eyebrows? Good. Okay, what did we just do?
Cranial nerve.
7.
Good. Okay. So as I'm going through this, I can still do these things here, and I'm doing anything that's on the face or in the head, I'm doing now, and then I'm going to work my way down. Do you guys see where I'm going with this? Okay. So then from there, I'm going to take my pen light. Mine's not really working right now, but we're just going to pretend. Ah, there you go.
I like not working.
Yeah, me too. Then I can just say it's broken. I'm going to verbalize. Okay, so now I'm going to go ahead, and I'm going to look at her eyes, and just when you look at me, just look at me or look this way. Don't look at the light, okay? And that's what you have to tell your patient, because sometimes they look at the light and then they blind themselves, so just make sure you do that. So what I do is I look here, nope, from here, good, and I come around, and then I look again. Okay, good. And then can you look at my pen for me, please, once you're ready? Ooh, eyes are watery, you could document that. No, you're okay. Okay, I'm going to bring it closer, so follow my pen wherever it goes. Good. Tell me what I'm doing, guys.
Cardinal.
What did I do before that?
Accommodation.
And what did I do before that?
The pupil equal dilatation.
Perla, right?
Yeah.
Pupils are equal, round, react to light, correct? And I just did all of that within a motion. Pretty quick, right?
You also did direct and consensual
Yeah.
pupil reaction.
Yeah. So I'm sorry if I'm doing more than that's what I did on my assessment. So if I did something extra, just take it out. Just take it out.
And there's a twinkle in there too.
Yeah.
And she could have been done with what you just did.
Oh yeah, which I saw, but I guess I should have verbalized that. I'm
That's
sorry.
okay. No
But when
problem.
I was going up, I already saw it because she was looking at the light because she was
Yeah.
following it, but she sees
Yeah.
that light. So you're kind of doing it all at once. So let me just repeat what I did, okay? So I came here, looked at her scalp. She already talked to me. I already know that she's alert and oriented ×4. She's listening. She's appropriate, right? So she's good. Perfect. We already know that. You just have to verbalize it. I'm not going to verbalize everything. I'm just showing you what to do. Make sense? Okay, so then from there, I looked at her, I looked at her face. I went to see if there was any abnormalities. The skin is appropriate for race. Okay, and I already said it's warm, dry, and intact. There's nothing going on there. There's no lesions or anything. She has a little acne here and there, but it's nothing serious that you need to worry about. So then from there, I did my perla, right? So I took the light, shined it in her eyes. Then I started here. I flipped it, okay? And I did the accommodation. Okay, and then I can, you don't follow, I'm showing them. Like I did this. And then I did my cardinal fields, which here, I did the twinkle already. Boom. Twinkle's done. Yeah. And then here, and just do your six columns, follow it, right? And you guys always say your cranial nerves are intact and all that fun stuff. I'm not going to go through that because you already know. But know as you have to verbalize it, though. I'm not verbalizing it, but you have to verbalize what cranial nerves are intact so your professor knows so they can check you off, okay? All right, so I did that. Good. Okay, so as I'm going through it, and I usually have my patient touch their eyes and their nose and stuff if they can do it. So then you don't have to, because sometimes they get really uncomfortable when they get really close to your face or get to their face. You know what I mean? So I'm going to ask her, can you go ahead and just bring your eye down like this? Good. And then as you do it, you can take your pen light if you need to. I can just see like this. But you can see that it's China white here, it's pink, there's no infection, no swelling, there's no purulent drainage, correct? Can I see the other eye, please? Good. Same thing, okay? And you can do that, and that's fine. And you still have to verbalize what you're seeing, and if there's any abnormalities, you have to let your professor know. Regardless if it's normal, you still have to say it's normal, okay? Okay, so what did I do so far?
You did the, right, starting with the program and then.
Let's go ahead and start from the beginning, because like I said,
Excuse me, I'm sorry I'm interrupting, but we're looking at a time constraint.
oh,
I know you like to have them repeat everything to
Yeah.
you. I'm gonna give you
I don't have
permission.
to have them repeat, I can just do it
I'm
really
gonna
quick.
give you permission to just go straight through it
Straight through,
and
okay.
don't repeat anything.
Okay,
And then
you have to follow. Alright,
it
sounds good.
it'll save some time.
No, that's fine, that's fine.
Thank you.
Okay. No, you're good, thank you for letting me know. Okay, so we did that, so now I'm gonna go ahead and move on then with the other parts of the face. Okay, so now you guys would have to palpate and everything and look at the parts of the mouth. So what I would do here is after I did the eyes, I usually go from inside and work my way out, okay? So then I would look at the nose, and I would go ahead and have her make a pig nose. So go ahead and make a pig nose for me on your own. Yeah, you can ask your patient to do that, that's fine. I would look inside, see if there's any pink. I see some pink, redness, some hair, but nothing, so there's no swelling, there's no drainage, okay? No bleeding. Okay, and then from there, then I would have her do the whole, I call it a snot rocket, but don't say that when you're assessing. Just do the patency, okay? So patency, go ahead and do that for me. And then do it on the other nostril. Perfect. So they can blow in or blow out. I do both while they're doing it. So I go, and then, so it's done. Does that make sense? Yeah, good. I heard a little boogie there, but I was kidding. Okay, so then from there, I'm going to go ahead and look into your mouth. Go ahead and smile for me really quick. See, I'm looking at the gums and the teeth, making sure they're in place. They're all intact. Her gums are pink, no infection. Go ahead and open your mouth for me if you don't mind. I'm looking in there, and I'm seeing if there's any signs of infections or any cuts or lesions on the tongue or the cheeks, and if the teeth are in place, okay? Then from there, you're going to check with your, I don't have it, but like your little stick, you know, and you're going to see if the uvula rises while you're doing it, and that's when you say if it's intact. Huh?
We have to say it right. Yeah.
Oh yeah, with phonation. Then you check the tonsils too to see if they're 1+1, 4+, whatever. 4+ are touching, +1 they're not even showing. So whatever that is. Usually people don't show or they don't have them. Okay. So while you're in there, get that done. Get it out of the way because their mouth is already open. Just do that. Make sense? Okay. So I already inspected everything so far on her face. Am I right? Am I missing anything? Okay. So then from there, after I worked on the middle, I'm working my way out. I'm going into the ears, okay? So as I do this, I'm going to go and just touch your ears really quick. Does this hurt? This hurt? Sorry, my hands are freezing. And you have your gloves on. Does this hurt? Does this hurt? Okay, so I'm just taking a turn, you guys, from the opinion, just making sure there's no pain. You have to palpate, because if you don't, then you miss something, okay? Now from there, you would take one of those. I'm not going to do it because I don't have time to move around, but I would look into the ear, right? So you bring it up. Look inside. What are you guys looking for when you're going in here? Do you know?
Any wax, any redness,
Any
fluid,
All right.
in
And
the ear.
yep, you want to make sure that you're looking to see if it's pearly, white, gray type look, and there's no signs of infection, any redness or swelling, or if there's any drainage especially, okay? Because they may have a ruptured eardrum and you don't know. Make sense? Okay, good. So let me make sure I got everything there while we're going. So then you do your facial sensation stuff. As far as like, you can take the little cotton ball, you can use a swab or something, you can do the facial sweep while you're on the face. Do you feel that? Good. So you say that cranial nerve is intact.
Yeah, your eyes
Yeah.
have to be closed.
But you guys know what I mean, right?
Yeah.
You have to do this, yeah, because obviously they're going to see you do it. They're just, yeah, you did it. Right.
Cranial
Make sure
nerve
their eyes are good. Yes, absolutely. And then you do the TMJ. Make sure that you're palpating. So if you hear any clicks or feel any clicks, sorry, my hands are freezing. Okay, so go ahead and do it for me. Okay, I don't feel any clicks. Good. So you check for TMJ, do the palpation. Do you see how I'm doing everything on the face and getting it over with, so I'm done with that step? And then you can do your cranial nerves and everything there, whatever's there. You also want to do, I usually do my lymph nodes while I'm up there. So whatever lymph nodes you have, you would check here and here and down here and here to get that out of the way too, okay?
And if she's in the pole on the jaw.
Yeah, you can do that. I don't remember doing that in mine, but you can. If that's in your assessment, do it.
The pole on the jaw.
Yeah, like if you clench your teeth and pull, there's strength there. If it is, then do it. If not, don't do it. Okay? Alright, good. So, moving on. Okay, so we did facial symmetry, we did everything of that nature, we did your lymph nodes so far. Speech quality, just go ahead and say light, tight, dynamite for me, please.
Like tight dynamite.
Good, okay. So we're done with the face, am I correct? Alright, we did everything there. Alright, so now I'm going to work my way down, and I'm going to do this portion here, okay? So I'm going to do is I'm going to go and have you turn your neck side to side. Make you shrug your shoulders for me. Good. No, there was no pain or anything there? Okay, I'm going to have you push, or I'm going to have you push up. Good. What I just did is range of motion and strength against resistance with the neck and with the shoulders. So that's already done, okay? Because that's where my next place is. And as you're doing it, as I said to my girls, you're working outside, working your way in. So you're looking at the skin while you're here before you do anything, and you verbalize to your instructor what you see, okay? So remember that. As you're going through the steps, you always have to start with the skin first and do your range of motion, strength against resistance, get that out of the way. From there, you can palpate your lymph nodes. If you forgot to do it here, then do it right now, okay? And then you can palpate here and so forth. Now, while I'm here, I have to look at her thyroid, right? I have to look at her trachea to make sure everything's in place. So as I'm looking, I see that so far it's midline, which is good. There's no deviations present. Now I come back here, cut and short. You're going to feel for that trachea, and you're feeling that thyroid, and you're going to shift it kind of back and forth. Not too much force, because then you could cause injury, but do it to where if you feel anything. Oh, we're stopping? Oh, okay.
Time to go.
Oh.
All right, be quick, take sorry.
Sorry.